Dear friends, welcome to today's live stream. So this month we are going to have rapid revision MCQ series. So every week Saturday I will come live at 8 p.m. Okay, so every Saturday 8 p.m. Don't forget the date and timing. So we will try to take one topic and we will try to have rapid revision of MCQs. So if you have doubt, you can always ask me as usual, right? So first of all, can you all hear me? So am I audible, guys? Tell me. Let me see who are all online. Can you hear me? Okay. Okay. Akash, thanks for letting know. So today's topic is extracellular matrix. So this is the topic we have taken today. You all know initiative, right? So we are having Operation NEET PG 2021. In that, I'll be taking 20 hours of biochemistry course from August 21 in the Plus platform, and there will be 5 hours of live MCQ revision. Guys, you give your best and life will give its best in return. If you want to subscribe to the Plus platform, feel free to use this code Dr. Karthi. You will get instant 10% of discount. So let's begin with today's questions. The first question is this: all of the following are components of extracellular matrix except. Tell me. So for that, you should first understand what is extracellular matrix. If you know what is extracellular matrix, you will be able to answer the question correctly. Okay, Akash Saha is answering. It is good. Let's see. Okay, we have V cellular components, right? So what is extracellular matrix? So this is a acellular matrix. So in the extracellular, you have a acellular, some proteinaceous substance. So you have a lot of glycoproteins are there, right? So what are the other proteins of extracellular matrix other than collagen, elastin, fibrillin? Anyone answer me? What about the other proteins of extracellular matrix? Are you aware of this fibronectin? Are you aware of laminin? So these are the other proteins of extracellular matrix. So actin and vimentin, you might have heard, right? Vimentin, desmin, right? Actin is a thin filament. So in the cytoskeleton, you have thin filament, intermediate filament, and microtubules. So these are the 3 categories. Okay, Akasha is saying, yeah, fibroblast, they will secrete these components of extracellular matrix. For example, collagen will be secreted by fibroblast. Not only fibroblast secretes collagen, chondroblast will also secrete collagen in specialized tissue, right? So chondroblast in cartilage, osteoblast in bone. Is this clear, Akash? So fibroblast generally secretes the components of extracellular matrix. In specialized tissues like chondroblast and osteoblast, they also secrete. Good. Sunil Bharadwaj, nice. Correct answer. Next question: which of the following is a non-collagen collagen? Look at this terminology, interesting terminology. Which of the following is a non-collagen collagen? Okay, Abhibruto is saying video is not clear. Please refresh your screen. Please refresh your screen, close it and open. So sometimes that will also work. And open. Okay, let's see. So VS Narayana is saying option D. Akasa is saying option. Sabarinath, good. Sabarinath is saying but A. Akasa is also saying fibrinogen. Cha. Well, first of all, what are non-collagen collagen? So this term is given in your Harper textbook. Okay, so don't think that this is something which I came up with. They also have this glycine XY repetitive sequence, right? So those proteins having this glycine XY repeating unit are known as non-collagen collagens, right? So that is, so it seems everyone is confused. So the answer is C1Q complement. Okay, C1Q complement that has this glycine XY repeating sequence. Who told correctly? VS Narayana. VS Narayana told correctly. Excellent, VS Narayana. Okay. So other than that, are you aware of a protein, surfactant protein? In the lung, you have surfactant, right? The surfactant is made up of protein and lipid. The lipid component of surfactant is dipalmitoyl lecithin, otherwise dipalmitoyl phosphatidyl and the surfactant also have a protein component. This surfactant protein A, B, right? So they are also having this glycine XY sequence. Excellent, guys. So you all told correctly. So DPPC is the lipid component of surfactant. Surfactants have a protein component also, right? So now we are going to discuss very easy MCQs. So now this you will be able to answer it easily. Answer: which of the following is present in basement membrane? So these are all very easy questions, right? Which collagen is present in your basement membrane? Answer fast. This is very easy question. So it is type 4 collagen. So what kind of collagen is this? What kind of collagen is this type 4? What is the difference between this type 1 and type 4 collagen? What is the difference in the nature? Excellent, excellent. Okay, so it will form a network, right? So it is not like your type 1 collagen. Defect in type 4 collagen will lead to which syndrome? Alport syndrome, right? So remember this. Next question: which type of collagen is abundant in bone and fibrocartilage? So bone and fibrocartilage. Answer this. So Abhishek, it is bone and fibrocartilage it is asking. So abundant collagen. So good. So when they say bone and fibrocartilage, it will be your typical type 1 collagen. What about the other types? Let's explore all the other types also. Which type of collagen is abundant in hyaline cartilage? If the question comes like this, then you should answer which one? Good. Excellent, excellent. Abhishek Kumar, B.S. Narayana, Sabarinath. So you all answered correctly. So in hyaline cartilage, it will be type 2. Abhiprato Karmakar, good. So it will be type 2. Which type of collagen is abundant in granulation tissue and keloid? So this answer I expect rapidly. You know about keloid, right? In the surgeries parters, they give keloid, and you know the region where it most commonly comes, right? Sternum, this region, right? So people with black skin, right? Black people with black skin, they are more prone to getting this keloid. Abhishek Kumar Singh, option A is not the answer. The answer is excellent, excellent. Sabarinath, V.S. Narayana, Abhiprato Karmakar, good. So it is your type 3 collagen. Okay. So you all might have studied about the difference between hypertrophic scar and keloid. So that is a favorite question, right, in surgery viva. So in the keloid, it's going to grow. So that is because of your type 3 collagen. What is the treatment of keloid? What do we give? We give intralesional injection. Intralesional injection of steroids, right? So we give steroids. So why do we give steroid? What will the steroid does here? Tell me, guys. So what is the role of giving steroids intralesionally for keloid? So if you see Genong, in Genong it's clearly given that steroids will inhibit the fibroblast from secreting the collagen. Okay. So I looked into the Genong for this. In the Genong, they clearly mentioned that steroid will inhibit the fibroblast. Okay. So fibroblast only secretes the collagen, right? Correct, correct. Dina Dayalan, nice, nice. So that is the mechanism of action of your steroids. Now let's explore more into extracellular matrix. Good, Dina Dayalan, nice. So now answer this. All are true about collagen except. So here you will know a lot of facts also. So whenever you have questions like this, you have more knowledge to get. So option A says vitamin C is required for the maturation of collagen chain. Option B says alpha helix of collagen is right-handed. Option C says every third amino acid of collagen is glycine. Option D is saying proline provides rigidity to collagen. Okay, let us see. Abhiprato is saying B. Akansha is saying D. So now we have a difference of opinion. What about the others? Let's see what others are thinking. Okay, so there is a tie between option D and option B, it seems. So Priyadarshini, good. Akash Saha, good. Oh, Nitish, you are here. So Nitish is saying option B. Let's see what others are thinking. Okay, Nitish changed his mind. Now he is saying it is option D. So guys, I put this question just to make you realize that there is no alpha helix in the collagen. Remember, that is alpha chain. Okay, don't confuse alpha chain for this. That's what. See, what do you think is Nitish? That and all, it's for alpha helix. Okay, clear? So this is alpha chain. The collagen helix is not alpha helix. Remember this. That's why I put this question. Very important question. Collagen helix is not alpha helix. Okay, so it is a different helix, right? Collagen helix is different from alpha helix. So it is, the name itself is, it is collagen helix, we say. Okay, clear? So it cannot be alpha helix, so that is excluded, right? Good. Vitamin C is required, that you know, prolyl hydroxylase, lysyl hydroxylase, they all require vitamin C. Tell me, what is the cofactor for lysyl oxidase? What is required for lysyl oxidase, guys? What is needed for lysyl oxidase? Which micronutrient is required? Excellent, excellent. Copper, right? Good. So it's a copper dependent enzyme. Good, good, good. It's a copper dependent enzyme. Nice. Okay, good. Next is also this kind of question only to make you think more. All of the following are features of collagen except it is a fibrous protein. The triple helical structure is essential for its function. Phenylalanine is more abundant than glycine. Prolyl and lysyl hydroxylases are involved in post-translational modification. Find out the wrong statement. Abhishek Kumar Singh, Humayun Khan, Deenadayalan, V.S. Narayana. Okay. So you all got this correctly. Nitish, Priyadarshini, nice. So you know there are two types of protein, right? Based on the axial ratio of a protein. It will be globular protein and fibrous protein. Albumin is an example for globular protein based on the axial ratio. Okay, collagen is a fibrous protein. The triple helix structure is very, very important. Okay, so Nitish is asking, sir, please repeat alpha helix and collagen helix. Okay, so what this is, so you have secondary structures of protein, right? Secondary structures. So you have alpha helix and beta sheets. Okay, so excellent Humayun. So keratin, collagen, these are all fibrous proteins. Good. So secondary structures, alpha helix, beta sheets. Okay, so in the alpha helix, in one turn, if you see the number of amino acids, I don't encourage you to memorize the number of amino acids. That's why I'm not going to tell that. Okay, so the number of amino acids per turn, if you see, it will be different in alpha helix and collagen helix. Is this clear, Nitish? No need to memorize these numbers and all. Okay. So anyway, 3.6 in collagen helix, it will be I think it is 3.3. It will be different. Okay. So that is a different kind of. So what is this alpha helix? You have a phi angle, psi angle, you know, right? So how we characterize secondary structure? Based on the phi angle and psi angle of the Ramachandran plot. So in the phi angle, psi angle, you plot the phi angle and psi angle in the Ramachandran plot, and you will find that, okay, this is coming in this position, so this means it's a okay, good. So that's what. So in the book, for the completion sake, I have given more details. No need to memorize all these deep numbers. So Nitish? Okay, good that you are memorizing numbers also, fine. Okay, good. Clear? Phi angle, psi angle. That is the basis of secondary structure. Does anyone want to know? Hi Salim. Just 8 more minutes are left. Does anyone want to know more about this? Pi angle, psi angle, this alpha helix, beta sheets, or we can discuss in some other class. Shall we move ahead? We have some questions to cover. Tell me, shall we move ahead? Okay. So anyway, let me complete this. So in the peptide bond is rigid. So the peptide bond will be rigid. C double bond O, NH is the peptide bond, right? This bond will be rigid, but the carbons around them, they will be like, they can be rotated. Okay, that is the based on your phi angle, psi angle. CC will be psi angle, CN will be the phi angle. So based on this, we have this structures and all. Okay, let's have some more questions before we close the session. Desmosine tetrafunctional cross link is present in. Desmosine link is present in which of the following? Answer this. Good, Salim. Good, VS Narayana. Oh, Humayun Khan. It's not in the collagen. Okay, not in collagen, Humayun Khan. Akash, Abhibrato, good. So this desmosine cross linkage. So this you know, right? Like we oxidize the lysine. So lysine has the epsilon amino group. So when you oxidize this, okay, Salim, okay, Salim. So when we oxidize the amino group, you get a shift base. So 3 oxidized one, and with unoxidized epsilon amino group, they condense to form this desmosine cross link, right? So that is characteristic of desmosine, not collagen. Mutation of which of the following gene leads to Marfan syndrome? Tell me. So defect in collagen will lead to many disorders. So name certain disorders: osteogenesis imperfecta, then Alport syndrome, epidermolysis bullosa. Okay, so there are many forms. Good. Okay, so Ehlers-Danlos. So there are many forms, right? Elastin defect. Elastin defect leads to which disease? So let me give a clue. Cardiac valves. So now tell me, elastin defect, cardiac valves. Excellent. William, right? Williams. Good. So fibrillin defect leads to Marfan syndrome. Okay, defect in fibrillin. So how does it lead to Marfan syndrome? So what is the basis of this? You see, the role of fibrillin is, one of the roles of fibrillin is to bind TGF beta. Binds TGF beta, transforming growth factor beta. It's a growth factor, right? So this has a TGF beta binding property. So if there is mutation in the fibrillin, it can no longer hold TGF beta. This will lead to release of TGF beta, right? So this TGF beta will have a growth promoting property. So that is why you have a tall stature, right? So Abraham Lincoln is said to had this morphanoid features. You must be knowing, right? So tall statures, then lens dislocations, lens dislocation. The problem with Marfan is aortic aneurysm and dissection, ultimately leading to dissection of the aorta, right? Good. So you all know this now, right? So the defect in Marfan syndrome is due to fibrillin, which in turn increases the level of free TGF beta. Good. Answer this. Excellent, Obiproto. Defect in FBN1 gene. Good. So that FBN1 gene is there in chromosome 15. So these are the information which are not required to be remembered. Okay. No need that chromosome 15 and all. Not that important. So answer this. Which of the following enzyme is not involved in the post-translational modification of tropoelastin? Okay. So what about others? Nitish, answer. Obibruto, answer. Okay. In elastin, you have desmosine linkage. You know this, right? There is no confusion in this. You have a desmosine linkage. How did we get the desmosine linkage? We oxidize the epsilon amino group of lysine, right? We oxidize the epsilon amino group. So you must have lysyl oxidase. Clear? You should have lysyl oxidase to oxidize the epsilon amino group of lysine. Is this clear, guys? So how can you choose lysyl oxidase? Without lysyl oxidase, you cannot create desmosine linkage. Okay, this you should know about the difference between collagen and elastin. So under this important point we have, okay, so prolyl hydroxylase is there. Okay, prolyl hydroxylase you have, but you don't have a lysyl hydroxylation in elastin. In collagen you have all of the above. Okay, in collagen you have prolyl hydroxylase, lysyl hydroxylase, lysyl oxidase, everything is there for the collagen maturation. Okay, for elastin you have only these two enzymatic steps, right? So there is no hydroxylation of lysyl residues required for the maturation of tropoelastin. Okay, good. So now answer, which of the following amino acids of procollagen is glycosylated? So you know about glycoproteins, right? So there are three types of glycoproteins: O glycoproteins, N glycoproteins, and GPI anchored glycoprotein. So serine has OH group, lysine has amino group, but you know N glycoproteins, they always are linked to the amide group of asparagine. So obviously lysine you can exclude, but hydroxylase also has OH group, hydroxyproline also has OH group. So this is just a memory based question only. So So which hydroxyl group is glycosylated? The answer is, many of you told correctly, it is your hydroxylysine residue. Okay, so hydroxylysine residue is the one which is glycosylated. Excellent, guys. So let me remind you about the next free class. So you have a class tomorrow itself. So tomorrow I want to meet all of you at 9 p.m. in the Unacademy app. We will discuss 20 MCQs in the topic nutrition. Also, you can join my Telegram group Biochemistry with Karthi, so that you will get all the notification about the future class. So this month's schedule is, I will come live on YouTube every Saturday 8 p.m. In Unacademy, I will come every Sunday 9 p.m. So there will be a total of 8 sessions this month. Okay, so 4 plus 2, 6 hours. Okay, Salim, I'll try to answer as soon as possible. Now I am going for some other important work. I'll answer. So don't worry, you have a PhD entrance exam in August 21. You have time. Okay. Clear? So 6 hours of free classes are there. So I want all of you to attend the sessions. Okay, guys. See you tomorrow 9 p.m. Bye.